spin it down and separate out the white blood cells. Now, just out of curiosity, do you guys remember what the percentage, or when we're talking about the distribution of white cells versus red cells versus platelets are? In other words, how many red blood cells are there per cubic millimeter in blood, approximately? I know people come up to you on the street all the time and ask you that.
8%?
Yeah, if you were to take a sample of blood, how many red blood cells are there per cubic millimeter?
25 million.
Oh, you're close. No, actually, it's kind of about 5 to 8 million per cubic millimeter. White blood cells, you have about 5,000 per cubic millimeter. And I'm bringing that up because in some situations you have patients that don't have enough white blood cells to label, correct?
Is that 500,000?
What's that?
Oh, can you just tell us the numbers really quick?
Okay. Red blood cells, 5 to 8 million per cubic millimeter. White blood cells, typically about 5,000 per cubic millimeter. Platelets, about 150 to 200,000 per cubic millimeter. What's important though, yeah?
Sorry, my question was, how does that make sense if they have an infection, but they don't have elevated frequency?
Okay, well that's one of the things you have to look for. If the person does have an infection, then usually the white blood cell count is elevated. Usually it's over 10,000 per cubic millimeter. But sometimes you have patients that have chemotherapy or their immune system is compromised because they've had a transplant. They're on steroids or other anti-inflammatory medications. So those types of things have to be taken into consideration. So if you've had a patient that had radiation therapy or chemotherapy and their blood count is low, you're going to have to take more blood, or you have to use donor blood. So sometimes that happens. You'll have to use, a donor either the same blood type or O negative. Okay. Now the other thing about HMPAO, notice that the study must be completed within 2.5 to 3 hours if you're imaging the abdomen or pelvis. Because remember, this stuff gets cleared out through the liver and it's excreted into the biliary tract. So HMPAO with technetium, pretty much it's for immediate imaging, and you can't do a 24-hour study. You also can't do any imaging of the lungs. So if all you're looking for is the abdomen or pelvis, you can inject it with the technetium HMPAO, and so long as you get everything done within a couple of hours, you're good. But after that, then you can't do it anymore. Okay. Now this is another thing here, the sensitivity and specificity. What does sensitivity mean?
If somebody has it, how well can it detect it?
Kind of. So the sensitivity is if there's something there, can it detect it? Okay? So that's, when 90%, that's pretty good. Specificity means that, yeah, there's something there and it is an infection. Okay? So specificity means that you're looking for an infection, that's what it's diagnosing. And so white blood cells, very good for that. But mainly this is for an acute infection. If you have a chronic infection, then white blood cells aren't as good. Gallium, on the other hand, now gallium works on a different principle than radioactive labeled white blood cells. Okay, we'll talk a little bit about how it works, but like I said, gallium used to be our mainstay for doing infection imaging, but now with the white blood cells, it's a lot better. So it's a big contender.
What's the sensitivity with gallium?
Sensitivity is about the same, but the problem with gallium is the specificity. The gallium will light up, showing you that there's something there, but it isn't necessarily an infection. It's like with a bone scan. When you guys do a bone scan, our MDP is really sensitive, but it's not always specific for metastasis. I mean, if you have arthritis or a fracture or anything like that, or osteomyelitis, that'll pick it up too. But anyway, so that's one thing, and I think in one of the chapters of Ann Steve's, they talk about, I think it's like chapter 4, they talk about this, you know, statistical analysis of this stuff. Okay, but anyway, so going back, so the white blood cell count should be about over 5,000, okay? If you have less than 5,000, notice, you know, like around 2,000, you need much more blood, okay? You may need to use donor blood, okay?
So do patients usually have a CBC prior to us doing the WBC?
Yeah. Well, that's, see, this is, unfortunately for us, we kind of forget these little incidentals. And so, one of the other things, if the patient is taking antibiotics, or if the patient is taking steroids, or any other anti-inflammatory drugs, that's also going to affect your ability to see things. It's, you know, most people don't bother to check that either, right? Patient's taking aspirin or something. But the other thing is that if you have a low white blood cell count, then you may have to use donors. And I also put down here, avoiding tests in infants, because white blood cells, as you've noticed, they tend to accumulate in the liver, but mainly in the spleen. So, look, a kid can get up to 60 rads. What's the recommended dose for an organ for a person? You guys know what your annual doses are. What's your annual allowable doses, right?
5 rem.
5 rem per year. Okay, how much is it for the lens of your eye? 15 rem. These are on your boards, by the way. And for any internal dose, what is it for your internal organs? It's about 50 rads. Okay, those are occupational limits. Okay. So, I mean, even though there is no specified limit for patients, you know, technically you can do whatever you want almost with them, but if you have an infant and they get up to 60 rads, that's a really high dose, and that's the critical organ. Okay, if you guys look at your white blood cells things. Then notice it says for the Indian protocol, 18 to 24 hours post-injection, right, half a millicuries of white blood cells. Dual imaging, medium energy collimator. Why do we use a medium energy collimator for this?
Because gallium.
Okay, mainly the 247, right? So anything above 200, you should use a medium energy collimator. And then also the SPECT imaging, especially for liver infections or abscesses. Okay? Now this is the normal distribution of what you would expect on a Indian scan. And okay, so you notice that basically bone marrow, liver, spleen, really hot. Okay, spleen is really hot. Okay, and that's typical. But again, notice there's no bowel or renal activity. Okay, if I use gallium, then I can have renal activity. Okay, so then I don't know if I've got a kidney infection or just the normal excretion of the gallium. Okay, HMPAO, well, we'll take a look and see some of that in a minute. But, so again, you should be able to recognize whole body images based on what organs are showing up. So whole body indium like this, gallium, bone scan. What else do you do? What's it again? 131, MIBG, yeah. So based on what you're seeing here, okay?
So on the whole body, Serotype and Indian, you said immediately if we scan them, the lungs will show up and the liver and spleen, right?
Yeah. Yeah, within the first like 4 hours, it's just because you have a lot of mast cells in the lungs. And so what will happen is the white blood cells will go to the lungs, they hang out there for about 4 hours, and the bad news is by that time the abdomen is now full of, you know, HMPAO with the technetium. With the indium, it doesn't get excreted out through the liver, so you don't have the problem of the inability to see the GI tract. So here's an interesting scan here. Does the patient have osteomyelitis? First of all, what are we looking at here?
Infection?
24-hour Indian.
Yeah.
Okay,
Like the liver and the spleen.
so you guys see anything that you're concerned with on this patient?
There's a lot of activity in the lungs, so.
Low
Brain
rate.
activity.
What about down here? Anybody see anything on the leg? Okay. So this is what we're looking for. Okay. When they say discordant, that means that if the sulfur colloid is abnormal and the white blood cell scan is normal, that means that it's discordant. So in other words, if you see uptake with one but you don't see it with the other, that means that there's a discordance. If you see that sulfur colloid gets picked up and Indian gets picked up, that's concordant. So if you see both of them, same location. Okay. This is what they're saying here. So if you have white blood cell is positive, the sulfur colloid is negative, that's an infection. If you have the white blood cell positive and the sulfur colloid positive, okay, that means that the bone marrow is overactive or it's packed. So again, no infection. If the white blood cell is negative and the sulfur colloid is negative, then that's also concordant and there's no infection. So these are the three combinations that you would be looking for. Okay? Because going back, okay, we have an area down here, and if we didn't do a sulfur colloid, we would say, oh, this guy probably has osteomyelitis or something going on there, right? Cellulitis, infection. Does that make sense? Okay. Looking around, I mean, this is not one of the better scans that I've seen. I think on some occasions maybe people try to use a low energy collimator on this, and so you may have some septal penetration and you get some scatter and stuff that doesn't look too good here. Okay, so let's take a look here now.
Sorry, can you go back to the other slide? That one.
This one?
No, the one with the words. That
Okay.
one, sorry.
So discordant means that you have one's positive and the other one is negative. Okay?
The positive is a normal or abnormal.
Well, positive means you have an abnormal accumulation of white blood cells. Okay? And the sulfur colloid is negative. Okay? So that's definitely an infection. The concordant means that either they're both positive or they're both negative. Those mean that there's no infection. But if you have white blood cell positive and the colloid is positive, then you have marrow packing. So for some reason you've got bone marrow that's a little bit overactive in the area, which may be a good site for a biopsy if you have other blood problems going on. Does that make sense? I'm going to send you this too, by the way, so don't, Okay, so here we go here. Osteomyelitis, right distal femur. Okay. Let's take a look at the WBC and the sulfur colloid. Okay, so here you have a sulfur colloid.